my curtain is not showing. Oops. All right. Okay, we're set.
Yes.
Good evening, ladies and gentlemen. My name is Michael Oyagha. Once again, you are welcome to the Watchman Young Adult Forum, and we very much appreciate your joining us for today's event, for today's summit. Today, we are going out of what we've been doing for some time now. What I mean by that is that today we are looking at something that is very, very important. Other things we discuss also are also very important, but today we are looking at something that relates to our health. And somebody said that health is wealth. I personally believe that it is not appropriate, it's not proper for us, not to pay attention to our health, because without your health, you cannot get your wealth. So, and it is not proper for you to get wealth and now start looking for health. Okay, so today we have the privilege of having one of us who is a medical practitioner join us to talk on the topic peptic ulcer, the disease of peptic ulcer. Well, I have some issues with the topic, but let me reserve that until after his talk. Now, I want to welcome specially to this summit today Dr. Promise Okeke. Dr. Promise Okeke is a medical practitioner, and he has been in the practice for a while. Before we came on live, I was going to introduce him as a married man, but he's not married yet. So just keep your fingers crossed for those of you that love a wedding rice like myself. So keep your fingers crossed. Very soon we are going to invite you. So with a clap, if you are there with us, let's welcome on board Dr. Promise Okeke. Doctor, you're welcome, sir.
Thank you very much, Barrister.
How are you doing?
I'm doing very well.
And how is the practice?
The practice is going well. Remember what I told you sometime in the morning? But God is our strength.
Don't worry, the Lord will see you. The Lord will always see you through.
Amen.
When I was growing up, one of the first thing that always comes to my mind whenever I hear that word doctor is injection. As if that is the only thing that doctors know how to do, giving people injection. You say, hey, come here, come and take injection. But over time I've come to understand that the work of a doctor is actually more than curing, if that would be correct. Taking care of those who are sick is actually more of trying to get people informed and then prevent illnesses and all of that. Because by the time you are getting to the point of now talking about taking care of the ill health, by then you have gotten to the extreme. I don't know if I'm correct, but that's my opinion anyway. What do you think?
I think you're correct. Sometimes there are some sicknesses we just have to manage over a period of time until God calls the person home. So you're right, sir.
Okay. So today we are talking about peptic ulcer disease, and I am here to learn, and I'm very sure that all the people that are joining us are also ready to learn. Peptic ulcer is one thing I hear among a lot of people, especially believers. Oh, I have ulcer. Oh, I have ulcer. Well, I'm not going to preempt what you have to say, but I'm going to leave the stage now so that we can hear from you. You are the expert. And at the end of the day, we'll get into some discussion. So the floor is yours.
All right. Thank you very much, sir. So everyone, good evening once more. And we're going to be talking about peptic ulcer disease. I'm going to enlarge my screen now so that you will see the screen very, very well.
I can go off so that you have the floor.
All right. So, like some of you who may have seen the advert or the publicity flyer for this program, for this health summit, you must have seen a story that I told. Now, in that story, I said I witnessed a brother, and it was a life story. Yeah, it is a life story. So I witnessed a brother who was always eating small, frequent meals. Morning, afternoon, night, midnight. Then he do come to our house. So every moment, every now and then, you see him being so uncomfortable. I think I was in my final year then. When I came back home, I saw him. I even had to write some ulcer drugs for him. He had gone to the clinic earlier, and the doctors told him that he had ulcer. So he was always disturbed and always looking for the drugs and foods to help calm his ulcer down. So along the line, he got better, and today he can eat anytime he likes. So, and there are very many people listening to this health summit now who have peptic ulcer disease. And so I'll just go straight to the point. In this health talk, we'll be looking at an overview of what peptic ulcer is. We'll be looking at the types of peptic ulcer. Also consider the symptoms. What are the causes, the risk factors, treatment, the complications of peptic ulcer disease, and also the prevention. Very important. So, as an overview, how do we define it? We say peptic ulcer are sores which develop inside your stomach, okay, and the upper portion of your small intestine. The most common symptom of a peptic ulcer is stomach pain. So here we see that peptic ulcer, they are sores. Another synonym for sores are wounds. Where are they located? They are either located in the stomach or in the upper parts of the small intestine. All right, so let's go to this image. This is an image of the stomach, of the inner part of the stomach. And this area is the duodenum. This duodenum is is the first part of the small intestine. Everyone have it, including you and I. So you can see some sores inside the stomach. Okay, you can see, and it can also develop into a hole inside the stomach. When the sore forms, okay, it can form a hole. So that's the stomach. That's how the ulcer looks. It's a sore, a form of redness, and then that's the hole. So what are the types of peptic ulcer? We have gastric ulcer. When you hear about gastric, when you hear the word gastric, gastric means stomach. Okay, gastric means stomach. So gastric ulcer occurs inside the stomach. Then the duodenal ulcer occurs in the upper portion of your small intestine. We call that duodenal ulcer. And also we have esophageal ulcer. Esophageal ulcer is the one that occurs in the esophagus. The esophagus is just here. When you eat your food, there's a pipe, okay? There's a pipe through which food comes down into your stomach. This pipe here, okay, down into the stomach. So that's the esophagus. And some ulcer or some wounds can occur, especially in the lower part or middle part of the esophagus. And that's why we'll have the esophageal ulcer. So we are done with this. So this is a pictorial diagram of, okay, what I just explained. When you eat, this is where the food passes through. This pipe, okay, is the esophagus. It goes down into the stomach. Now, like I said, ulcer can occur in the esophagus, can also occur in the stomach. So I hope you understand this part. Now, what are the symptoms? I've seen patients when they come to the clinic most times, their first complaint is stomach pain or heartburn. Now, as I'm talking, you should be picturing yourself, okay? Checking yourself. Which one do you have? Is it this one you have? Is it a burning stomach pain? Some will come and say, everywhere, every part of my belly, they hurt. I have had some come to say, everywhere, my chest, doctor, my chest is on fire. Okay, so when we check and ask the patient some questions, he or she goes ahead to tell us that, sorry, the diagnosis or after the investigations test which we do, it goes ahead to show us that this person has peptic ulcer. Another symptom is feeling of fullness or bloating. So this comes like this presents this way. Some people, once they take 1 or 2 or 3 spoons of rice, they become full. Or once they eat, they discover that their stomach becomes abnormally bloated. Okay, abnormally bloated. That is to say that the food they eat is not commensurate to the size of their tummy. The size of their tummy is abnormally bigger, and this is as a result of air. All right, air within the stomach. So they feel fullness, feel bloating, and then some of them, oh Lord, when they come to the office, just sit down and you're talking with them. They tell you, doctor, I have heartburn. Before you know, in your presence, they are belching. As in, some of them cannot even control it. So that is one of the symptoms. Okay. Another one is intolerance to fatty foods. Some people, once they go to eat foods such as fried yam, okay, they discover that their body will change entirely. Serious abdominal discomfort. Some of them may even start because they had fried yam or fried potatoes. Okay. Now another bone. I've talked about that. Some go get have some vomiting symptoms, vomiting every now and then. Auntie, why you they vomit? I get ulcer. So what there means the feeling to vomit, okay, is the feeling to vomit, not the actual vomit. So some of them present with these are those symptoms which I just talked about. They are mild. Now there are severe symptoms, okay, when especially when the peptic ulcer disease has developed okay, it can, like I said, it's a wound. Just imagine that you developed an injury, okay, a wound, and you see it bleeding on your skin. That's how it is. So some ulcers, they bleed. All right, that's a complication. So some ulcers bleed, and the blood may be seen as red or black when the person vomits it. Okay, so some of them see dark blood when they go to toilet. They see dark blood sometimes mixed with their stools, not just mixed with their stools, it could just be coming out of its own. Okay, dark blood. Some of them have troubles breathing. Yes, we've seen them. They come to the clinic. Okay, you see them breathing fast. Madam, waiting happen. She or he doesn't know that it's peptic ulcer that they are having. Some of them are feeling faint, maybe as a result of not eating well. Then there is unexplained weight loss. You just see yourself losing weight unexpectedly, unexplained. Why? Why is this happening? Because perhaps you're not eating well. And so there are also appetite changes. Why will there be appetite changes in these people? Why will they present with this kind of symptoms? It's because whenever they eat, they have discomfort. Their chest is so hot, their stomach is so hot, and so they prefer not to eat because they don't want trouble. They don't want to feel so uncomfortable rather. Now, the most common peptic ulcer symptom is a burning stomach pain. I want you to understand at this point that the stomach contains acid. All right. The environment of the stomach is acidic. When you eat food, the food gets into the stomach and is digested by the acid. So the normal environment of the stomach is acidic. All right. So here we understand that the most common symptom is a burning like fire. Okay. Some people eat beans, and when the beans goes down, they feel hotness here. Okay, we'll call it the epigastric region. Okay, so all the symptom is called heartburn. So go forward. I told you that there are three types of ulcer, and so we're going to look at the differences between a gastric ulcer and a duodenal ulcer. At this point, I just want to look at the point where it starts. For those who have duodenal ulcers, their pain starts 2 to 3 hours after eating. It doesn't happen at once. Now, the duodenum, remember I told you, is the intestine, okay? And the stomach leads into the intestine. So these people feel uncomfortable 2 to 3 hours after eating because the food has left the stomach going down to the intestine, and so they feel uncomfortable. And then they can also feel this heartburn at midnight. All right. For those with stomach ulcer, they feel their pain immediately after eating, as the food is just going down the pipe or the esophagus into the stomach. What happens immediately? They feel discomfort. Why? Maybe because the food is already touching the part of the stomach where the ulcer is, and so this is just how you know whether it's duodenal ulcer you have or gastric ulcer you have. Another important thing to know is what stimulates this pain. For some people, it's hunger. Like the person I told you about, once he's hungry, he eats. Okay, why does he eat? Because he feels discomfort. Okay, that's to show that what he has is duodenal, or what he had was duodenal ulcer. Now let's go to gastric ulcer. Gastric ulcer is stimulated by eating. All right, once you eat some kind of food, you begin to feel uncomfortable, some heartburn, abdominal pain, and all that. Now, it's PUD is peptic ulcer disease. So please take note because I'll be using it often. How is peptic ulcer disease formed? We need to know this. Basically, peptic ulcer disease occurs when acid in the digestive tract, okay, your digestive tract is this esophagus. Okay, let's go back here. This is your digestive tract from this, your mouth, all right, down through this pipe is your esophagus, the path through which food passes to the stomach. From the stomach, these are the intestines. Down, these are the small intestine. And then this big one, just around the small intestine, is known as the large intestine. So from the mouth down to your anus is called your digestive tract. Now, when I use the word digestive tract now, I'm referring to the stomach where the ulcer occurs, and also the duodenum, which is the first part of the intestine. So we're talking about how peptic ulcer disease is formed. I see when PUD occurs when acid in the digestive tract eats away, begins to eat the inner surface of the stomach, okay, or the small intestine. This acid can create or that can bleed. So I hope you understand this, that the stomach has natural, there's hydrochloric acid, okay? There is another acid called pepsin, all right? It's in the stomach and it's responsible for the digestion. So pepsin is an important chemical in the stomach, and that's where the name peptic came out from. Pepsin is found in the stomach and is responsible for the digestion of foods. So PUD, this source in the stomach occurs when the acid in the stomach begins to eat into the layers of the stomach. So I hope you understand this part. Now, your digestive tract is naturally covered by layer, don't worry, I'll explain it, that protects against the stomach acid. But if the amount of acid is in or the amount of mucus is decreased, you could develop an ulcer. What this means, your stomach is not protected from this ulcer. The walls of your stomach is naturally protected ulcers. Okay, now protected from the acid that is by what? By layer. Okay, but now it can be increased. If it is increased in, okay, this can lead up this mucus, this area of the stomach. It can lead to the eating of, can develop ulcer. This is the is formed as in up, all right, the stomach or the intestine. What are the causes of? There is a bacteria that is implicated, is Helicobacter pylori. We call it pylori. This bacteria is not in everybody, okay? It's not in everybody. Some people who have not developed ulcer, but there are some other persons who have ulcer. So we say a bacteria, this is a bacteria which lives in the stomach, okay, mucous layer that covers and protects tissues, okay, of the stomach. Causes no problem sometimes, but in some people, wound in the stomach's inner layer, producing an ulcer. This bacteria can be transmitted from person to person, from your person at home, all right? And it can be contacted through, remember I said that the digestive tract starts from the mouth. When you exchange body fluid, it's through that means. People may also contract H. pylori, this through food and water. Now, another is the regular use of certain pain relief, aspirin, Felvin, ibuprofen, and all that. All those we call them non-steroidal animals. So for you who easily goes to the chemist to purchase aspirin or Felvin or ibuprofen, check it after you take such drugs. You may just start feeling uncomfortable in your chest. So people who regularly take this and develop peptic ulcer disease. Now, risk factors. Things that we do that can make us, either worsen the ulcer condition or make us develop ulcer. One, people who smoke have a good likelihood of developing um, PUD. Another one is alcohol drinking. People who binge on alcohol, they can develop ulcer. I've seen them. Not resting, you're always stressed. Okay, if you continue to be stressed, okay, without worsen your ulcer or make you develop one. Now, eating spicy or peppery food does not in itself cause ulcer, but can worsen ulcer condition in people who have PUD. Being a female, okay, being a female can predispose you. Don't ask me how. That's what we were told, that being a female can predispose you to, that is a risk factor for having ulcer. 65 years and above. Now, on its own, on their own, above do not cause ulcers, but they can make ulcers worse or make ulcer difficult to heal. Just imagine that you have ulcer and peptic ulcer disease, and your doctor gives you drug to, and you're taking the drugs and you're still smoking. How do you want to get healed? You're taking the drugs and you're still eating your very peppery foods. How you're taking the drugs and you're still taking alcohol? How do you think you get better? So complications, conditions that occur when a peptic ulcer disease is left to untreated, like the person doesn't care what's happening. Now it can lead to bleeding. I explained um, earlier that ulcers bleed, serious bleeding. Okay, can cause serious bleeding. So see a patient. When I talk about bleeding, some vomit. Okay, and when they vomit blood. All right. Some go to toilet and they discover that there's blood in their stool. So their stool is mixed with blood. There are stooling blood. Now that's internal bleeding. That's a complication. If ulcer is left unattended to, it can cause internal bleeding. All right. That's what we call perforation, a hole in the stomach. Remember, I said initially that a hole, all right, in the stomach. Now, imagine that this is okay, and the hole developed here. If nothing is done by the patient, cause healing, the acid can keep eating deeper into the stomach and cause a hole here as well. So now imagine how it's into the stomach, but is passing through the hole to this place, out of the stomach, causing infection, what we call peritonitis. So, okay, yeah. So it's a complication of peptic ulcer disease. Another one is obstruction, all right? It can cause obstruction to the flow of food, flow of feces. So some people with ulcer as a complication, with obstruction as a complication of ulcer to go to toilet. I've seen such cases. All right. When I was doing my internship, a woman, she had obstruction from ulcer. The ulcer had persisted and persisted, but I guess on her own she has been trying to get better from the ulcer, but it didn't work. All right. So along the line, she could not go to toilet on her own, and so it continued. It persisted. She came to the hospital. All right. So she, you know, some surgical procedures were, and physics was now coming out from another path through a pipe. Okay, because there is obstruction along the path through which physics comes out. Now this image is showing how ulcer looks like. Um, this part where you so sorry. I did not know when my network disappeared. We are still live. Okay, so I'm just going to share my screen now. Please, sir, where did you say I will stop saying it?
Can you hear me? All right.
Yes, I
From
can hear.
the diagram of the intestine, from that point, we stopped seeing what was happening,
Whoa.
and
Okay,
then
I'm
down
sorry.
to eating peppery food, alcohol, and smoking.
Okay,
So we
so
got lost
we're
at that
now
point.
okay. From here.
Um, Back a little, back.
Okay. Yeah.
Yes,
Oh, but you were hearing my voice, sir.
yes, we're hearing your voice, but we're not seeing the presentation.
Oh,
So we're trying to
okay.
create the images in our head.
Oh Lord, I'm so sorry. Okay. Um, I don't know. Can you see my screen this way, sir?
It's a bit tiny.
Okay.
Mm,
I don't know. Is the slide moving now?
not yet.
Okay. That means we just have to yeah. Okay.
But we are flowing with you anyway.
So let me just do a recap from this
Yes,
place.
please. Yes, please.
Okay. All right. So sorry, viewers out there. I didn't know when network disconnected me. All right. So I was saying the symptoms of ulcer include a burning stomach pain, feeling of fullness, okay, feeling of fullness, abdominal bloating, intolerance to fatty foods. Okay, you eat fried stuffs and you discover that you are not getting any digestion, or your stomach is burning, all right? So you feel serious abdominal discomfort. And I say that there are also severe signs and symptoms of peptic ulcer disease. And they include vomiting, all right? Some people vomit. When they vomit blood, all right? And the color of the blood could be red or black. I also see it. Some also find dark blood in their stools. All right. Some also have troubles breathing. They have difficulty in breathing. Some also feel faint. All right. And some also develop appetite problems. That is loss or lack of appetite. Yeah. So I also say the symptoms include the most common symptom of ulcer is abdominal pain. All right. And then I also talked about the differences between stomach ulcer and duodenal ulcer. I see that for duodenal ulcer, which is intestinal ulcer, which some people have, what happens here? For such people who have duodenal ulcer, they their own pain, abdominal pain or chest pain, starts about 2 to 3 hours after eating. All right, starts about 2 to 3 hours after eating. While the people who have stomach ulcer, their own pain as they are eating, immediately they just finish eating, their pain has started. All right, so I've seen people with such complaints. Now, some persons, their own ulcer, their own pain is stimulated by hunger. All right. Once they get hungry, they see themselves wanting, feeling uncomfortable. These people have duodenal ulcers. All right. Then for gastric ulcers, their own pain is stimulated by eating. Once they eat, they feel uncomfortable. I hope you understand this part. So I also talked about how PUD, which is also peptic ulcer disease, is formed. And if you're listening to me, maybe you're not seeing my screen very well, no problem. Just hear me and I will explain. I say that peptic ulcer disease is formed when acid in the stomach eats, okay, eats deeply into the body of the stomach, eats deeply, creates a hole. That's how it is formed. All right. And I also said that the stomach, the digestive tract, is normally covered with acid, especially the stomach. There's hydrochloric acid in the stomach. There is pepsin also in the stomach. All right. So when these acids eats deeply into the stomach, it causes problems and discomfort. And I also say part of the causes, major one of the major causes of peptic ulcer disease is what? Helicobacter pylori. It's a bacteria which is found in some people. So, Barrister earlier asked me, why is it called a disease? It's because most times a bacteria is implicated. So, and the name of the bacteria is H. pylori. And so it's this pylori, H. pylori, can be found in the stomach of some people. And then it can destroy the protective layer of the stomach. And when it destroys the protective layer of the stomach, acid will now begin to eat deep into the stomach. Okay, and I also said another major cause of peptic ulcer disease is regular use of certain pain relievers. You that just go into the chemist, say, Oga, oh yeah, abeg, help me mix drug. I dey get stomach pain. So Oga in the chemist will not ask you, do you have ulcer or do you not have ulcer? Because he's not a doctor, so he's not going to ask you such question. But when he wants to mix drug for you, you mix paracetamol, you mix diclofenac, you mix Novalgine, you mix many pain relievers and give to you. And when you get home, you drink it, you discover that you develop problems. We have seen such patients. So this is just to tell you, stop going to chemists to buy drugs. Chemists, they are not doctors, okay? Some of the drugs they give you can cause you wound, can cause you ulcer. Now, risk factors to the development of ulcer. I said number one is smoking. Sorry if you're not seeing my screen clearly, okay, but just hear me, I'm talking about it. So, one of them is smoking, all right? People who smoke cigarettes, excuse me, have the tendency of developing stomach ulcer. Those who take alcohol, all right? Those who undergo stress, those who eat spicy or peppery foods. All right, spicy or peppery food does not cause ulcer on its own, but it can worsen the state of the ulcer. I said also being female can cause this. Those who are 65 years and above have a higher tendency of developing peptic ulcer disease. I also talked about the complications. What are the complications of peptic ulcer disease? One is internal bleeding. I say that some ulcers bleed, and that is the truth. If it is not taken care of quickly, if it's not attended to quickly, it can bleed. Another complication of peptic ulcer disease is what we call perforation. I explained that the ulcer, the acid could create a hole in the stomach. Now, imagine that a hole is created in the stomach, and from this surface, it digs down to this surface. All right, causes a perforation. Such people, when they eat food, gets into the stomach and then seeps out from the hole, causing multiple infections for the patient. And I also said another complication of peptic ulcer disease is obstruction. Some of them come down with obstruction to the flow of food. All right. Some of them come down with obstruction to the flow of feces. They can't go to toilets. Okay. Oga, go. Go toilet now, e no fit go. Why? Because there is an obstruction. A scar has been formed, okay, in the wound. The wound has formed a scar, and so causing obstruction to the flow of food. And I say this area that is around the uh, that is this area which the yellow circle is covering is an ulcerated area, is somewhere that has sore. So imagine eating and food coming down this path and digestion is taking place. You will feel discomfort if anything comes across this ulcer. This is the stomach of somebody who has ulcer. Now, prevention. Just listen to me if you're not seeing my screen. You need to use pain relievers with caution. Earlier, I said you don't just go to a chemist shop to get, don't do that. Get to a doctor. When you get to a doctor, some patients are so smart. They will quickly tell the doctor, Doctor, I have ulcer, so I beg, no give me this drug. Okay? Yes. Patients who know their health condition, what they have, okay, and they know the drugs that will worsen their conditions. So they tell the doctor in advance, Doctor, I beg, no give me this one, oh, okay? I get ulcer. But when they go to the chemist, they can't tell the chemist that. Chemists will not even ask such a question. Okay, so use pain relievers with caution. Sometimes when you know you're taking ibuprofen or diclofenac, ensure to eat. All right, eat food before you take these drugs so that it will not cause you heartburn. Avoid foods that irritate your stomach. Foods such as spicy food, chili, citric fruits, fatty foods, okay? Avoid them. If you have peptic ulcer disease, there are some kind of foods you have to avoid. The reason you need to avoid them is when we tell you to take these drugs that will cause healing, okay, in your body, and you keep taking these foods that you should not take, you'll discover that there's a word, it's a vicious cycle, all right? No healing will occur, all right? So you need to avoid foods that worsen your ulcer. Check yourself. Are there foods that you take that disturb you? You know you are ulcer patient. Don't take them. Take the drugs that your doctor prescribed for you for a period of time. You will get healed along the line. Then another way of preventing peptic ulcer or stomach ulcer is to quit smoking. Stop smoking. All right. Quit alcohol intake. Learn to control your stress level. Try to relax. Okay. You cannot come and kill yourself. Some people stress worsens their ulcers. Okay, so you need to relax. Another important preventive measure is washing of hands. Try to wash your hands very, very well with soap and water in order to prevent transmission of that bacteria I call H. pylori or Helicobacter pylori. So before you eat fruits, ensure to wash the fruits very well. Before you eat food from somebody's house, ensure you maintain hygiene, measures before you do such. Overeating and eating within 2 to 3 hours of going to bed. Some people immediately they just finish eating. They know they have ulcer, they know they have such disturbances, but immediately they finish eating, what do? They go to sleep. When you go to lie down, there's something we call reflux, gastro. Let me not speak the plenty English, but when you eat, the stomach has acid, like I said, and so when you go to lie down, the stomach contents will want to come out. So the acid will want to come out, the acid in your stomach or the food contents of your stomach, which is already mixed with the acid in your stomach, will try to come up to your esophagus. And when it comes up through the pipe, you feel heartburn. That is because you just finished eating and you went to sleep or you went to lie down. Now, there are certain foods that you should avoid. If you have peptic ulcer disease, there are certain foods you should avoid. I hope you are with a pen and paper, so you'll be writing this. Carbonated beverages such as Coke, Fanta, Sprite, okay? Avoid them because when you take them, you cause more production of acid in your stomach. Okay, so once you know that you have ulcer and you want it to heal, you want your ulcer to get healed, you should avoid carbonated beverages such as soft drinks, avoid taking of coffee, all right, avoid chocolate, avoid taking peppery foods and peppers. You know, some people like taking chilies from Indomie spices and all that. So some people eat Indomie and discover that they are not feeling well. All right, they are having abdominal problem from eating Indomie. The spice in that Indomie is disturbing them. If you want your ulcer to get healed, you need to avoid taking such spices. Foods with high amounts of salt and oil also has to be avoided. Okay. Now, fried food, fried yam, fried potato, fried this one, fried that one. If you are somebody who takes such food, you need to avoid them. And I mean, if you have peptic ulcer disease, because the more you take this food, the more it will affect your stomach, and the more it will affect your stomach, the more it will affect your ulcer. So all right, sorry, I'm back on. I'm having network issues here. Okay, so I'm almost done. So we are at treatment. Treatment of ulcer includes the use of antibiotics. Antibiotics, well, antibiotics is used if there is bacteria implicated in the causation of your ulcer. Once the bacteria is implicated, then the doctors usually prescribe antibiotics. Another one is antacids. Okay, the antacids are responsible for reducing the production of acids. So you have antacids in your marketplaces. You should ulcer patients are usually given antacids. Another pump inhibitors, ulcer patients, you know these ones, drugs such as omeprazole, lansoprazole, rabeprazole, and the rest of them. So those are drugs which ulcer patients are given. Another one is acid reducing drugs such as what we call cimetidine. In conclusion, peptic ulcer disease is treatable once you adhere to the appropriate diet within the specified period of time you're taking the anti-ulcer medication. So to cap it up, from patients I've seen, what I tell them is, okay, we want your ulcer to get healed. And so you should be willing to take this drug from this anti-ulcer medication from 3 to 6 months constantly. And then avoid all these foods I've mentioned. Some of them find it difficult, definitely. We're in Nigeria where this kind of foods cannot be avoided. But some of them who eventually do that discover that they get better. So, a very important take home from this lecture is that if you want your ulcer to heal, as you take the anti-ulcer medication, that is the medications the doctor prescribed for you to take to heal the ulcer, you must try to avoid foods that worsen the ulcer condition, and then your healing will come. I think I'm done here.
Thank you very much, Doctor. That's a whole lot of information concerning PUD, peptic ulcer disease. And I'm very sure that everyone that has been part of the seminar or the summit would have gained one or two things from there. For those of you who are joining us on the Facebook, and if you have any question, please you can type your questions. We'll take them as they come in within the time that we have left for this program.
Okay.
We still have the prayer summit this night by 11 p.m. So we'll encourage every one of you to join us for the prayer summit. Before then, let's have one or two chats with the doctor. Now, I'm going to start from the back, as in starting from the end
Okay.
to the beginning, like what you
Okay.
just said concerning the fact that peptic ulcer can be healed, because a lot of people have this misconception that the moment you are suffering from peptic ulcer, it cannot be healed. So it can actually be healed then.
Yes, it can be healed.
Okay.
Yes, like the person I talked about, the brother I talked about, is a brother. He got healed, he got better. So, yes, it can be healed. I believe in spiritual healing. I also believe in medical healing. So, yes, God can heal people with peptic ulcer diseases. I'm sure you may have had such testimonies. And also, people can get healed from taking the medications. Yes.
Okay. 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 So it's not as if it's not a terminal disease, as it were.
It is not a terminal disease, not at all.
Okay. It's fine. Now, I was saying before we started the program that when you use the word disease, peptic ulcer disease, it has a way of affecting the psychology of whoever it is, that, oh, I have a disease, compared to you have an illness, or compared to you are sick. I don't know if there's a way that can be balanced, because I know that the healing process begins from the mind, actually. So if the mind is already conditioned to see whatever body situation as a disease, it may be a bit difficult for the healing process to commence. I don't know if you agree with my view.
Well, let's just look at the definition of disease. Disease is not so much of okay. It's
Disease.
okay. So according to the dictionary, it says it's a disorder. Okay, a disorder of structure or function. A disorder of structure or function. That's what a disease can be. Okay, can be. That's what we can take a disease to be. A disorder of structure and function. Now, the WHO also defines disease in its own way. It can be any harmful deviation from the normal thing. Okay, just like you now, you are healthy, you eat, uh, your food get digested, no abdominal pain, no problem, nothing. But there are people who do that, who eat food and they get problems. So um, we can call that a disease. That's known as a disease. So viewers at home listening to me, I want you to know that the word disease It's a big word. It's just a disorder from the normal flow of things. Barrister, I hope you're getting me. Just
Very well.
a deviation from the normal flow of things. Let's just put it that way. So for people out there, the peptic ulcer disorder, okay? Peptic ulcer disorder. So it's a disorder from the normal things that should occur. It's not
Body.
big disease, a terminal something. People get healed from it. So.
Oh, okay, that's fine. Now, when you were talking about the symptoms of peptic ulcer (PUD), you mentioned bloatness of the tummy, you mentioned hotness, intolerance to fatty foods, having the feeling to vomit, and the rest of that. Now, I want to ask because I know that sometimes when a woman is pregnant, there is this feeling of vomiting also. Will it be
Yes.
safe? Will it be safe to conclude that the moment I'm having the hotness of tummy or hotness of my body, as it were, or I'm having the feeling to vomit that I have PUD, will it be safe to conclude, or one has to go for diagnosis first?
Okay, it's important here to note that peptic ulcer is common in pregnant women. As the tummy gets bigger in size, as it gets bigger in size, I showed you the picture of the pipe. So as it gets bigger in size, it pushes the stomach upwards. The stomach is on the left side, so it pushes the stomach upwards. And so when such women eat, the contents of their food they eat in the stomach try to push up, come up into the pipe, into the esophagus, causing them discomfort like heartburn. So some of them come down with that, but after pregnancy, it disappears.
Okay.
After pregnancy, that part now, or this particular one, is not called peptic ulcer disease. We call it gastroesophageal reflux. Gastro is the
Can you give
esophageal.
us a smaller name? That name is too wide.
Oh God. Let's just call it, it's a reflux, acid reflux.
Okay.
That is acid contents trying to push back into the esophagus, into the pipe through which foods goes into the stomach. So for
Yeah.
those pregnant women, when their tummy gets bigger, I say the womb of the woman pushes the tummy
Oh,
upwards and up, yes, and the contents of the stomach come up into the esophagus, causing her, it's acidic. Okay, the contents of the stomach is acidic, and it should not be, that acid environment is not in the esophagus. So when that acid environment mixed with food comes into the stomach, what happens into the esophagus? The woman gets discomfort, heartburn. So those people don't have peptic ulcer disease. They have GERD, gastroesophageal reflux disease, or for short, acid reflux, which usually such women can take antacids for them. Antacids, they are out there in the market, and after pregnancy, you get better. The symptoms stop. Yes, sir.
okay. You mentioned the fact that when you were talking about the things that stimulates the pain in a PUD patient, and you mentioned eating, you said eating usually stimulates pain in a PUD patient. So I'm wondering if I'm a PUD patient, it's assumed that it was because I was not eating that I had PUD. I'm still going to come back to that anyway. So if eating or food stimulates the pain, then does it mean I should not eat when I'm a PUD patient?
Well, I made that statement when I was differentiating between stomach ulcers and intestinal ulcers.
Yeah.
Yes, that was where I made that statement. And I said for the intestinal ulcers, what causes their pain, what stimulates their pain is hunger. And so
Okay.
when they are hungry, they go to eat. Now, this particular aspect is for us, the doctors. That's how we used to differentiate between a gastric, a stomach ulcer, and
Okay.
intestinal ulcer. So it's our own information. Just brought it out here for people to know how to classify which one they have and how to manage it. But those with stomach ulcers, they come down, they are only stimulated by eating. That is to say, when food gets into the stomach,
Causes
okay,
discomfort.
and digestion starts happening, yes, it affects the ulcer, the sore, the wound in the stomach, and then they begin to feel discomfort. So for these people now, this group of people with stomach ulcer, you discover that they don't want to eat. They don't want to eat. They eat less food because if they put anything in their mouth, I hope you understand me, sir.
Very well.
Because if they put anything in their mouth, they'll have troubles. That's
Yeah.
how you know those with gastric ulcer. They will
Okay.
have troubles. But these other people with intestinal ulcers, okay, their own is once they get hungry, they have to eat for the pain to go
To
to
go down.
subside. So that's an information for us doctors, and that's how we used to differentiate between kind of ulcers.
Okay, now there is a general belief that because I didn't hear you mention it at all through your presentation, that what
Okay.
causes ulcer is when somebody does not eat regularly. I don't know that might be a myth. I don't know whether it's a reality, but a lot of people
Well,
have that concept that if you don't eat regularly, you're going to have ulcer, including
I
myself.
had to leave that part out because not eating regularly, we can classify that as fasting. Fasting periods, not eating regularly. Well, in the thing is, in normal people, people who are, when I say normal people, people who don't have this ulcer at all, if they begin to get on fasting periods, the stomach acid, which is looking for something to digest, okay, can be produced by the stomach in excess. And definitely begin to eat to the stomach. And remember, I also said a bacteria is implicated.
Yeah.
That bacteria H. pylori, the name is H. pylori, can also damage the protective layer in the stomach.
Okay.
This now causes the acid in the stomach to begin to go deep. This acid is produced in the peripheral surface of the stomach.
Okay.
Peripheral surface. Yes. Now, if the bacteria eats deep into the stomach, what happens is that the acid will now be eating deep, causing a hole. So, in these people who undergo fasting or not eating regularly, true,
Yeah.
also can develop in them because when there's no food to um, digest, the acid definitely has to do digest something. Okay, so so it's important to eat, yeah,
Okay.
regular.
For our viewers, we have okay. Lucy has sent in two questions, very wonderful questions. She said, someone once told me about using unripe plantain water to cure ulcer. Please, doctor, do you think it's a better way of healing ulcer? A lot of us have this village mentality, including myself. So I don't know. Maybe the person is actually right that unripe plantain water can cure ulcer.
I'm not. I've never even heard of rice plantain. First, I know of unripe plantain, but I don't know of unripe plantain water.
Maybe you
No,
soak
I've
the
not
plantain
heard of
inside
that.
water and sip the water out of it and drink it, maybe to work.
Maybe that's for trado medical uh,
Practitioners.
practitioners.
Yeah.
Yes, I
Okay.
don't really know about that.
Okay. Now she said I once got across to someone, not a doctor, who said ulcer prevents a woman from getting pregnant and causes miscarriages for those who are pregnant. Is it true? Do you want to throw some light on that if it is true?
No, that is a fallacious statement.
Okay.
Uh, no, there's nothing like that. Peptic ulcer disease does not prevent anybody from getting pregnant. It does not prevent any woman from getting pregnant, and does not cause any form of miscarriage in such
Okay.
women. So yes, there are
Are you
people.
sure it doesn't cause miscarriage? Because you just said it now that the what did you call it now? The acid ilio what that ordinarily ought to digest food in the stomach, in the absence of food to digest, and it sees the fetus in the stomach. Don't you think that it can digest the fetus and cause miscarriage?
Okay, remember that the stomach is different from the womb. The
Okay,
stomach is a different compartment
okay,
covered on its own. Yes, while the womb is a different compartment altogether.
okay.
So these are two different things happening in two different places.
Yeah,
Yes. So the stomach, you know, okay, for the layman, we refer to this part as the stomach, but
yeah.
that's not what it is. The stomach is where food goes to when we eat food. That is
Okay,
the stomach. The whole of this part is called the abdomen. So the abdomen has the stomach, the liver, the intestine, the womb for the women,
yeah.
kidneys, and every other organ. So every organ in the abdomen and stomach is on the left side. It's just one part. So it doesn't cause miscarriage or any form of infertility in women at all. It does not.
Okay, beautiful. All right, I'm sure that the person has gotten the right information and we discard the fallacy that has been flying around. Now, you said that the bacteria that causes ulcer can be transferred. That means it is contagious. So, if I am a PUD patient, does it mean that I cannot KISS my wife?
Okay, you can, but she risks transmission. She risks getting it. Especially now, it's very important here to note that not everyone with peptic ulcer disease has the H. pylori bacteria.
Okay,
Yes, when they come to us, we usually send them for tests to check their stool or blood for the presence of this bacteria. So some of them come with the results, no H. pylori seen, but
okay,
they have ulcer. So it's important here to note that not everyone who has ulcer has that bacteria.
okay,
Yes, not everyone who has, but for the one who has ulcer and has the bacteria, person risks transmitting the bacteria to someone who is free of it. So yes, it can be transferred. Another way it can be transferred is through feces. If one who has the bacteria goes to the toilet, does not clean, just goes to the toilet, cleans the buttocks, does not wash the hand, and goes to shake another, okay, it can be transmitted through that way. So you go to shake hands and go to chop eba, and it enters into the mouth. So that is one of the ways that the bacteria can be transmitted in, and
I was
also
thinking,
through the.
I was thinking that the washing of hands was exclusive reserve of COVID-19. I never knew that it also relates to PUD.
The universal prevention of diseases, number one, is hygiene, washing of hands. Universal
Okay,
prevention. Yes, number one is washing of hands. It even has a special procedure. Washing of hands has a special procedure. That's the lecture for another day. So once people wash their hands with soap and water, many diseases
okay.
should be prevented. Yes, sir.
Wow, that is interesting. I'm sure that our viewers are really getting. I'm getting a lot of information right now because because there's been a lot of misconception about PUD and the rest of that. Like we already answered, fasting does not necessarily cause PUD, though it has a maybe a contributing factor. Okay,
Yes.
now let me ask this question. You mentioned it just in passing, not really relating to PUD, but then you mentioned the fact that everybody who's having PUD should avoid carbonated beverages. Now, let me ask: are there any
Okay.
benefits really? Are there any benefits that we derive or we get from carbonated beverages apart from the sugar
Uh,
content?
yes, sugar content one and caffeine. For instance, personally, when I was in school, there were times I took this special cook before I read my books, and I take the cook. Or once I take the cook, oh Lord, I get stimulated to read. It contains caffeine, so it's a caffeinated drink. So people take it, these soft drinks, not special. I think there's no benefit to our health. Okay, it's just some people are addicted to it for the
Yeah,
sugar content and for the
yeah,
caffeine. Caffeine is an addictive drug. So once people remember the way they feel when they take these carbonated drinks, want to take more of it. So no real benefits. For some other people, when their glucose level, sugar levels is going down and they're feeling weak and tired and they need, quick refueling, you can just go
yeah.
take carbonated drink and you get better um, within a few seconds. So that's just it.
Okay. Now, there was something you mentioned that I did agree with you, and I still do not agree with you. Even though you
Okay.
are going to explain, I will still not agree with you. So I'm just telling you in advance now that those who
All
are
right.
suffering from PUD should avoid chocolate. Why should I avoid chocolate?
Why should they avoid chocolate? That's because, well, if you don't agree with me, you can check it out. Chocolate can
Okay,
cause
okay.
or causes more secretion of acid in the stomach. Yes,
Mm,
remember that the goal of treatment of PUD is reducing acid production in the stomach. So when you take such things as chocolate, you're going against, if you are somebody who is already treating ulcer and you're taking chocolates, it's going to backfire. Yes, and that's the
okay.
reason why we say they should not take chocolates beverages. Yes,
So it doesn't help PUD patients at all.
it doesn't help the patient. Now, these things that we ask them to abstain from, it's not forever. It's for a
Okay.
period of time for
Yeah.
them to heal. Once they get healed, they can go back to eating whatever they want to eat. So it's for them to get healed. Once they get healed, like I said, they can always go back to eat those things we ask them to abstain from. It's not like diabetes. It's not like diabetes where doctors say avoid this food, and doctors telling you to avoid this food is trying to say avoid it for life, forever. Don't take it. It will spike your blood sugar level. It's not like that. Start get healed, and when they get healed, the patient can always come back to whatsoever we ask them to abstain from.
And if it goes back to what it was asked to abstain from, it will reoccur. It
Most
will
times,
reoccur.
yes,
It
it
will.
won't recall. But in some people, it recalls. It's very
Okay.
important to take note of that. In some people, it can recall, especially if they go back to bad eating habits. Yes, it can recall.
Yeah.
And also, if that bacteria is not cleared, if they have that bacteria and it's not cleared, so imagine the causative organism is still there
Yeah.
and perhaps the person is not feeling symptoms again, along the line, the causative organism can just rear up its head and begin
Yeah.
to do some damage again. So it can recur. Very important, sir.
Okay, so is it at the point of having totally dealt with the causative organism that one can say that you are healed of the ulcer?
Yes. One, that's one point. Dealing with the causative organism is one of the ways of saying the ulcer has been healed. Once the causative organism, which is the bacteria, has been cleared and removed from the digestive tract of the patient,
Yeah,
healing can occur. But this is for people whose ulcers are caused by this bacteria.
bacteria. Yeah,
Yes, by this bacteria. Like I said, there are others whose ulcers are not caused by the bacteria. It just happened maybe from stress, from during this Ramadan period, many of them with ulcers, some of them because their ulcers are aggravated, okay, by not eating, okay, they did not engage in the fasting. Some just engaged in the fasting for 1 week and started eating. Yes, so it's important to note in these people, healing can occur for some of them. Healing, okay, healing can occur for some of them. Some of them can have recurrence. Recurrence.
okay. Now, one of the things I have observed amongst us is not just us in this part of the world, but especially among believers, is that we do not actually pay enough attention to our health. All right, and you discover that before the person begin to run helter skelter looking for the medical practitioners and the rest of that is when the matter has become very very bad and has gotten maybe to the extreme. Now you mentioned a situation where the ulcer had gotten to the extreme and then the person is now bleeding. You know, you see signs of blood, red or dark blood in the stool and the rest of that. At that point, what can the individual do? Is there still any hope of medical healing? I believe in spiritual healing, but is there still any hope of medical healing at that point?
There is noise coming.
Okay, did you get my question?
But I got your question. Yes.
Okay.
Now, for such people, they still should proceed to the hospital. They should still go to the hospital. When the medical practitioners assess the patient, assess the situation, and see what's happening, then they will be able to say what can be done for such patients. Some of them, when they present in that complicated state, what they will need is surgery.
Mm,
Surgery, yes. Surgery, either perhaps they came in a state of they can't go to toilet. I explained that earlier. Some of them,
yeah,
when there is
yeah.
obstruction, they can't go to toilets. So imagine somebody who is able to go to toilet because there's an obstruction somewhere. So surgery will be needed to remove that obstruction. So surgery will be needed to remove that obstruction for
Okay.
the person to be able to defecate. Sometimes the obstruction may not be removed. It may get to a state where it can be removed and what we call bypass surgery. That is where some pipe is inserted into the down to the intestine for waste, for feces to be brought out. So it and causes and leads to more infection. So people at home who are watching this should ensure that when they get first sign or symptom of whatsoever prevention with, meaning number one, they don't go to toilet. Constipation, constipation, not going to toilet after you eat, or they use, they should try and go to the hospital. The devil is not in the hospital. It's just something to say that the devil that you're fighting against is not in the hospital. Yes.
I
So as
remember,
your pastor is praying, go to the hospital. God will also
yeah.
use the doctors to heal you. I think we should know this.
Okay. Your statement now just reminded me of what one medical doctor said, a medical practitioner said. He said, and he happens to be a pastor. So the
Yes.
wife was talking about, let's get a housemaid, let's get a housemaid. And he said, look, I don't want any housemaid in this house. And she said, why? He said, because I see enough devils and demons in the hospital, and I don't want to come back home and start casting out demons again. I just want to keep my food and go and sleep. Okay,
Well,
but
well,
I
the
believe that the devil is
diagnosis
not a
are
demon.
patients. I'm talking about the fellow doctors.
All right. Ichoma is joining us from Ikeduru in Imo State, and she's asking what could be the cause of an ulcer patient whose feces stains with blood, though the person has undergone a screening and no bacteria was found. Despite treatment, this blood stain in the stool would not stop. What do you think could be the problem?
Okay, looking at the question, like I said, not all ulcers, peptic ulcers, are caused by the bacteria. Yes. Now, for this person whose feces is stained with blood, it's a complication of the ulcer. That means the ulcer is bleeding. So each woman should know that it's a gradual process here, and the patient should be in the hospital. Because if bleeding is occurring this way, it can lead to a higher complication, what we call anemia,
Yeah,
shortage of blood.
blood.
So a
Yeah,
patient is having such patient can develop internal bleeding leading to shortage of blood, and shortage of blood, loss of life. So her question is, despite treatment, it still would not stop. I wouldn't agree with this. Despite treatment, it still would not stop. Where are you treating this patient? Is this
yeah,
patient being treated in the hospital? If
yeah,
it's a private hospital, have you taken this patient to a tertiary center, to a teaching hospital, to a federal medical center? These are the places where we have experts,
yeah.
those who are experts in gastric stomach ulcer. Have they seen this patient? Have they handled this patient? I believe that if they handle this patient should get better. That, uh, all things being equal.
Okay. Well, thank you very much, Doctor. It's been a wonderful time talking with you. If not for the other program that is coming up, we would have just continued the discussion because there's actually a lot of myths out there that people believe are surrounding this concept of PUD that needs to be debunked so that the minds of the people can be cleared and people can work with information that will guide them. Thank you so much for your time. You mentioned in the course of talking about washing of hand that we're going to have a separate lecture on that. So just be ready anytime soon. We'll call you back to come and talk to us about washing of hand. The only time people like us wash our hand is when you want to eat your food and when you just come out of the toilet. Well, you tell us more if there are other places we need to wash our hands so that we can be healthy.
Yes, just to add to what you just said, where bacteria is microscopic, which means we cannot see it with our
Yeah,
naked eyes. It is on every surface that you see. They are living organisms. They are living with us. Some of them are even inside us. Some are good bacteria, some are bad bacteria. So upon each surfaces that your hand touch, you should know that there is bacteria there. Aha. So when you understand that there's bacteria on the fridge, in the kitchen, on the pots, you will have this hand washing habit, or have a hand sanitizer around, especially for those who um, can just take biscuits and put in their mouths, whether they They don't care if they wash their hand or not. They just take something and put it in their mouth. So such people need to imbibe the habit of cleaning their hands with either soap and water or hand sanitizer, especially cheap. So we are in the strong coronavirus era. I think we must really fast.
Okay, that's great. Thank you very much once again for your time. Thank you, Beauty, for joining us. Thank you, Ijoma, Blessing, Ede, Joshua, Gideon, Chioma, Jesus, Gloria. Thank you, everyone. The ones I can see your names. I'm sure some other names have gone under the comments. Thank you so much for your time. And we hope you join us again some same time next week when we have some other things to talk about. For now, we are done. Join us by 11 o'clock for our prayer summit. Doctor, thank you very much for your time.
Thank you very much.
I hope as you eat this night, you're not going to sleep immediately. Of course, you shouldn't.
Hello, also.